China's capital has announced that it's cancelling all major public events for Lunar New Year as the country tries to stop the spread of a new virus. The extreme move comes after restrictions were ordered on 2 cities affecting some 20 million people. All public transport services, air, sea and road, out of the city of Wuhan have been suspended. That's where the virus was first detected last month. In the neighbouring city of Huanggang, all transport services will be shut down from midnight local time to prevent people leaving or entering. The Chinese government says that subway trains will be disinfected every hour. And the World Health Organization is meeting again to decide whether to declare an international public health emergency. Al Jazeera's Adrian Brown begins our coverage from Hong Kong.
At first, China's government warned people against travelling to Wuhan, the epicenter of the virus. Now, a day later, it's gone a step further and banned all travel to and from the city. 11 million people are effectively living in quarantine. That brought a measured response from the World Health Organization.
Trying to contain a city of 11 million people is new to science. It has not been tried before as a public health measure. So we cannot at this stage say it will or it will not work.
Many people fled Wuhan before the ban took effect. Unverified pictures posted on social media show signs of panic among those who stayed behind. A hospital in the city where face masks are now reportedly being rationed. Now the ban on public transport has been extended to other cities in central China. Arriving in Hong Kong, passengers from one of the last flights out of Wuhan. Silent by choice. The incubation period for the virus lasts up to 10 days. Doctors say it's therefore possible that some of them could be carrying a silent killer.
After returning to Hong Kong, if you have a fever or other symptoms, wear a surgical mask.
As this disease spreads, Hong Kong's medical authorities are raising awareness with cheery public service announcements. Like other parts of China, Hong Kong is becoming a city without a face. The official advice is to wear surgical masks in crowded areas, including on public transport. Yet some experts doubt they'll be effective. From Manila to Tokyo, airports across Asia are screening all passengers for signs of infection. Medical experts still don't know if this is a highly or mildly contagious disease. There is a lot the experts still don't know about this disease. They're still trying to find its source, and they're still not sure how easily it can spread from person to person. Adrian Brown, Al Jazeera, Hong Kong.
Well, Beijing has pledged complete transparency as it deals with the outbreak.
China will continue to maintain an open, transparent attitude, act in a responsible manner for the global health and safety, and report any outbreaks. We will maintain close communication with the World Health Organization, relevant countries and regions, including Hong Kong and Taiwan. We also believe that the Emergency Committee at the World Health Organization will base their findings about the outbreak on truth, science, impartiality, reasonable analysis, and sound judgment.
Peter J. HOTEZ is Dean for the National School of Tropical Medicine at BAYLOR College of Medicine in Houston. He is with us now live. Good to have you with us. From your perspective, is this unprecedented? How do you go about containing a virus like this?
Well, the best way to contain a virus is to have a vaccine readily available and to vaccinate the population. And unfortunately, the world did not respond after the SARS vaccine to have those vaccines in place. And we could talk more about that. But, you know, for now, I think what we're seeing with the Chinese leadership is a reaction, maybe an overreaction to what happened in 2003 when the SARS coronavirus erupted and spread across China, created global panic, affected Asian markets and other markets, and really shut down the city of Toronto after it was exported there. And the Chinese leadership was heavily criticized for not being proactive, not being transparent. So I think what you're seeing is a response to that and trying to double down, and that's why we're seeing the measures being taken right now.
How quickly can a virus like this be produced? As I understand it, it's a coronavirus, the same virus that causes the common cold, and there's no vaccine for the common cold.
No, but there have been prototype vaccines for SARS, the first serious coronavirus infection in the early 2000s. And for example, we developed a prototype vaccine for that. Then when we tried to seek funding to get clinical trials to advance it to licensure so we'd have it ready to go, the investor community said, there is no more SARS anymore. Why do we need a vaccine? And so we're still continuing to monitor it for its stability, but it's basically we haven't been able to advance it for all the safety testing. If we had done that by now, there's a possibility we'd have a vaccine ready to go. So we're in this situation where we're too much in reactive mode. We're not anticipatory enough and looking at the importance of vaccines and other countermeasures. But there's been some improvement. New organizations like CEPI that was created at Davos, the BARDA, the Biomedical Advanced Research Development Authority. And we've done improved things in terms of global health governance. After the SARS epidemic, we created the International Health Regulations, IHR 2005, which has increased steps-up monitoring at international transportation hubs, as well as create a global health security agenda. So there's no question things are better than they were in the early 2000s, but there's still a lot of holes in the system.
From what you know of this virus, are we all, regardless of age or state of health, as vulnerable to it? What do you look for in patients? Are these heat sensors at airports effective? Would they give you some indication as to who's got the virus?
Well, heat sensors may tell you if you have a fever, but remember the time of year this is happening. It's really happening at the worst time of the year possible, not only because at the start of Chinese New Year's when the whole country's on the move, but it's also at the peak of influenza season. So chances are that we're going to be seeing a lot of people with febrile illness, having fever, registering positive on those heat sensors. The overwhelming majority will have the flu, and so that's going to create a lot of confusion as well. So it's unfortunate that it's also happening at this time of year.
All right, really good to talk to you. Peter J. HOTEZ, they're Dean for the National School of Tropical Medicine at Baylor College in Houston. Many thanks indeed.